So what's interesting about diabetes is that we knew about it for a really long time, but it actually remained a death sentence through the early 20th century. To treat a disease, most often you have to understand the biology behind the disease. Diabetes is the loss of one protein from these islets, and they coined this protein insulin after the Latin word for island. So insulin is part of a group of proteins called hormones, and hormones are proteins that send signals through the body. And insulin is your food signal, so it signals that energy in the form of food is available. And so it's going to promote your cells to take up this energy, use whatever that they need, and then store the rest. And it's going to block the breakdown of your stored energy reserves. So you can see if you lack insulin, you would have a huge imbalance in these processes. So insulin is going to bind to its insulin receptor, and it's going to send this signal into the cell and allow for another protein called glucose transporter 4 to go up to the surface of the cell. So without this action, the glucose remains outside of the cell in the bloodstream and our cells can't use it. And that's really where type 1 and type 2 diabetes differ. In type 1, there's absolutely no signal, and we see starvation and very severe effects. Type 2 is still a very serious disease, but many type 2 diabetics actually don't show obvious symptoms. And so rather than patients having to inject themselves with insulin, they can wear these pumps. And these allow for programmed release of insulin, and they help people better control the amount of glucose or sugar in their blood. We also have glucose-lowering drugs that are commonly used in type 2 diabetes. The one here, metformin, is actually on the World Health Organization's list of essential medicines. It's very widely used. But I think the sobering statistic is that today, for type 1 diabetics, life expectancy is 10 to 13 years lower than for non-diabetics. The easiest way to explain it is that an insulin pump or any other treatment we have, while they're good, they do not equal the functioning of a human pancreas. So you may have heard of stem cells. These are the cells in the body that can turn into just about any other kind of cells. And what we can do in the lab is actually direct them down a path and make them be insulin-producing cells. And so if you take these cells and you put them in a little capsule, you transplant them into a diabetic mouse, you can make a sort of artificial pancreas. And so this is much closer to the actual pancreas, and we're hoping it will help diabetics achieve better sugar control and also lower the risk of side effects and complications.